As a pediatric physical therapist, I've been working with kids with autism for over 20 years. And this is why I can confidently say that women taking Tylenol while they are pregnant does not cause autism. I'm also going to discuss why this misinformation is so incredibly dangerous for women who are expecting. First of all, the American College of Obstetricians and Gynecologists, the American Academy of Pediatrics, and the American Psychological Association all agree that Tylenol does not cause autism. Now, there are some that'll say these organizations are corrupt and they're biased, they're in the pocket of certain pharmaceutical companies. It's complete bullshit. Pardon the language, but it's true. If you go into any medical profession, you are there to help people. You want to give them the very best advice as you can to help them heal, have a safe delivery, whatever your chosen profession is. These organizations form their opinions based on the most reliable and valid current research that's out there on any related topic, including autism. Now, yes, there's some research that's been out there that talks about a possible correlation between Tylenol or acetaminophen and autism, but it's important to understand the difference between correlation and causation. Now, some of these studies have said that there's been found to be some acetaminophen in the umbilical cord of kids who later grew up to have autism. However, that's a correlation, which means they both happen to be there. But a causation would mean that one caused the other. Just because the acetaminophen is in the umbilical cord and the child end up having autism does not mean that the acetaminophen caused the autism. To better understand causation versus correlation is, say your birthday is July 4th and you're celebrating your birthday and fireworks start going off and you're like, hey, this is great. Now, just because the fireworks are happening on your birthday does not mean that the fireworks are there because of your birthday. Your birthday did not cause the fireworks to happen. We know that the fireworks are happening because July 4th is the day the Declaration of Independence was signed, and it's like our nation's birthday. So just because the fireworks are there on your birthday does not mean your birthday caused the fireworks. So same idea with acetaminophen and in the umbilical cords and the children with autism. Just because they both happen to be there on some instances does not mean that one caused the other. So I'll get into what the current research is showing as probable causes for autism. But first, we'll just talk about now if research isn't quite your thing, there's just some simple basic facts about autism and its relation with Tylenol. First of all, the first diagnosis of autism came in 1943. Tylenol and acetaminophen were first produced in 1955. Something made in 1955 cannot cause autism, which was first diagnosed in 1943. Also, it's estimated that approximately 50 to 65% of pregnant women in the United States use Tylenol. Approximately 2% of the population has autism. So that math there doesn't add up. If there was a direct correlation between those two, or a causation, I should say, there would be a lot higher percentage of people with autism. Many reliable studies have found that there is a genetic predisposition to autism, with identifying over 200 genes that are directly related to autism. It's been found that approximately 80% of cases with autism came from inherited gene mutations, and approximately 20% were not inherited gene mutations. Now, it's believed that there are biological and environmental factors that can cause the gene mutations, which later cause kids to have autism. Now, what are some of these environmental factors? This is where the Tylenol thing comes up. Is the Tylenol being taken by the mom in utero causing some of these gene mutations? Well, there's a study performed in Sweden of 2.5 million kids, and they studied siblings. So they controlled for the genetic factor and then the acetaminophen. Now, what this study found is that there was zero correlation. So again, siblings, same genetic makeup, same parents. There was zero relationship between the kids who had acetaminophen resulting in having autism. There's another study published by the Journal of the American Medical Association studying the same thing, but a completely independent study, had about 186,000 kids. Again, having siblings studied and controlling for the genetic factors, they found the exact same results as a study in Sweden, showing that there was no basis for saying that acetaminophen in utero caused autism. Now, there is a medication that's out there which people believe might possibly cause some of these gene mutations in utero, and that's called valproic acid. It's an anti seizure medication. And for this reason, it is not prescribed to women who are pregnant. So, this kind of misinformation about Tylenol while moms are expecting is incredibly dangerous to them. First, they need something to help manage their pain, and they're not able to take the non-steroidal anti-inflammatories like Advil or Ibuprofen, Motrin, because of possible kidney concerns, low amniotic fluid, and they need something to help both manage pain and fevers. If someone's in a whole lot of pain, their blood pressure increases. Pregnant women are already at risk for higher blood pressure, and if it gets too high, it can cause aneurysms. And then, of course, there's fever management, which we know Tylenol is incredibly effective for. And if someone's fever gets too high, it's obviously a danger for both themselves. And if it's a pregnant woman, it's a definite danger to the fetus. Now, I am not a doctor. I'm not a neurobiologist. I base my opinions based on what those experts are saying and what the current research is showing. Please, if you have any questions regarding what is safe and what is not safe with your pregnancy, please talk to your doctor. Your doctor is up to date on the most current research and will make sure that both you and your little one is in the best hands possible and is getting the best advice possible. Thanks, guys. Take care.